welcome to the 17th Annual Hearts of Hope virtual celebration and tree lighting ceremony. The Hearts of Hope tree at St. Mary Medical Center is brightly lit to recognize family, friends, and loved ones who fill our hearts with love, joy, and hope for our future. More than ever, many of us have needed something positive to focus on, and one of the bright spots for community healthcare system is the cardiovascular research being done right here in Northwest Indiana. Your donations to the Hearts of Hope support vital research and clinical trials to bring advanced heart disease treatments to our patients and your loved ones. Thank you for your generosity and your participation in a program that inspires healing and hope to all who share heart health challenges. The Hearts of Hope celebration is also a time for us to thank our many cardiologists, electrophysiologists, and cardiothoracic surgeons, as well as nurse practitioners, physician assistants, and the many clinical staff who care for our patients. These teams work across community healthcare system to repair our patients' hearts, to bring them renewed hope and encouragement for a healthier future.
Community healthcare system cardiology care teams are proud to be part of a hospital system that is recognized as the largest and most advanced cardiovascular network in Northwest Indiana. Community Hospital, St. Catherine Hospital, and St. Mary Medical Center are accredited chest pain centers, meaning patients are treated and stabilized from the first point of contact, when their chances of recovering are the greatest. For this, the American Heart and Stroke Association's Society of Cardiovascular and Patient Care and the Joint Commission consistently recognize our hospitals for high-quality care. These distinctions help us attract talented heart specialists with high levels of expertise to identify disease at its earliest stages and perform advanced cardiac, structural heart, peripheral interventions, open heart, and minimally invasive procedures. New IT technology, the Cardiovascular Information System, has given the many health professionals who care for each patient quick, streamlined access to current and prior cardiac images from multiple cardiology environments, such as cath lab and nuclear cardiology. This helps the multidisciplinary team accurately pinpoint the full scope of a patient's needs in real time. Our mission doesn't stop there. Your contribution to Hearts of Hope funds important clinical research to reduce the rates of cardiovascular disease across Northwest Indiana. Today, 10 unique clinical research studies are underway at community healthcare system that will add to medical knowledge to treat, diagnose, and prevent a variety of heart disease conditions. These conditions include coronary artery disease, myocardial infarction, aortic valve disease, peripheral artery disease, and atrial fibrillation. One of the studies we offer looks at ways to dissolve clots in arteries of the lung. Another addresses potential advances in acute heart attack care for patients 65 and older. Additionally, the Cardiovascular Research Department provides education to patients on lifestyle changes, diet, medications, and rehabilitation. We offer health screenings and outreach events like Hearts of Hope. All this is wonderful to achieve because what really matters is that we are right here alongside you, preventing and treating heart disease with positive results together.
In February 2017, Mark Wilkins suffered from most severe type of heart attack called ST elevation myocardial infarction, resulting from blocked artery in his heart. When he arrived at St. Mary Medical Center, physicians there observed that Mark's heart was unstable and he has unstable chest pain. Mark was in need for an emergency percutaneous coronary intervention procedure to clear his blockage. He was taken to the cath lab where his heart rate dangerously slowed down, leading to a cardiogenic shock and arrest, causing him to code in that moment. CPR was performed immediately as staff worked together to keep Mark alive. Dr. Stepanovic worked on the emergency PCI, taking over 6 hours. The procedure was very complicated as the physician has to navigate multiple blockages that were cutting off supply to the heart, and he's required numerous attempts, advanced balloon, and other tools used to penetrate calcified blockages opening Mark's arteries and restoring blood flow. By this time, Mark's heart was very compromised and not pumping enough blood to the body, which could lead to permanent damage. His heart needed assistant pumping of blood in order to us to complete the procedure and open his arteries. I was called to lead the team to implant an Impella heart pump. The Impella acts as a bypass machine that pulls blood from the left ventricle through the rest of the heart, maintaining stable heart function. This reduced workload on Mark's heart and gave it a chance to rest, allowing us physicians to repair the damage and open Mark's arteries. The Impella also has helped the heart muscle pump blood to vital organs like his brain, kidneys, and the heart itself. Mark's prognosis was very poor going into surgery. Our ability to implant the Impella for his procedure was truly very remarkable. Mark was one of the first recipients of the new Impella technology at St. Mary Medical Center. Since then, community healthcare system has tapped into the life-saving power of the Impella on numerous patients like Mark.
I don't remember a lot of what happened. I remember the time leading up to it, and when I woke up, they told me I had been in a coma for 6 days. About a week before my heart attack, I hadn't been sleeping well. I remember getting up early on a Sunday morning. As soon as Connie saw me, she said, "Come on, we're gonna go to the emergency room." After that, it was a blur. I felt like I went in and out of consciousness every few minutes. It was actually a few hours.
I took Mark to St. Mary Medical Center. Dr. Stepanovich was the cardiologist on call. After a quick, thorough assessment, Mark was sent to cath lab to put a stent in his heart.
I remember flashes of it, all glimpses of being in the elevator, my family standing around me, nurses coming in and out. After they put in the stent, my chest and arm pain continued. Later, Connie told me I was white as a ghost. A nurse rushed into the room and called a code blue. I was having a heart attack.
I remember begging everyone who rushed over to help him, please, please, don't let my husband go. After the next 7 hours, Dr. Stepanovich, Dr. Ziegler, and Dr. Quamley did everything they could to restore blood flow to the clogged area of Mark's heart. At one point, I was told to call in the family. As I began my calls, God put his hands on Mark and the cardiologist team.
It was lucky Dr. Quamley was there that day. He was the only doctor in the hospital at that time certified to put in the Impella pump, a machine that helps the heartbeat. I was on the Impella in ICU for 7 days.
Everyone was wonderful, how they worked together to save his beautiful life. I have never seen anything like that.
We are so grateful for the care I received.
Thank you, Mark, for sharing your story. And thank you to Dr. Quamley and all of our heart care providers for the expert, extraordinary care you provide to our patients each and every day. We're proud of the work being done through Community Healthcare System, where complex cardiovascular technologies and techniques previously were found only at leading academic medical center. Mark's story is one from thousands of patients who have triumphed over cardiovascular illness and other heart-related conditions over the years. Thank you for your support. And now it's time to light our Hearts of Hope tree.